Severe abdominal pain or cramping during pregnancy is not something to ignore. While mild cramping can be common as the uterus stretches, intense or sharp pain could signal a serious issue. One possible cause is an ectopic pregnancy where the fertilized egg implants outside the uterus, most commonly in the fallopian tube. This condition can cause sudden, severe pain, especially in the early weeks of pregnancy, and it requires immediate medical attention. Another concern is placental abruption, where the placenta starts to detach from the uterus before delivery. This can lead to stabbing abdominal pain and is often accompanied by bleeding and contractions. Even issues like a urinary tract infection can cause lower abdominal discomfort, and if left untreated, it may progress to kidney infections or trigger preterm labor. It's also important to differentiate gas or constipation discomfort, which is usually dull and intermittent, from serious cramping that's persistent, localized, or increasing in intensity. Pain on one side only, or pain accompanied by shoulder pain, dizziness, or fainting, can be especially concerning. The key is to listen to your body. If something feels wrong or different from the usual pregnancy sensations, it's best to consult a healthcare professional promptly to rule out complications. Heavy bleeding or spotting during pregnancy, especially in the first or second trimester, can be a warning sign of complications, while light spotting can occur in early pregnancy due to implantation or cervical changes. Heavier bleeding, similar to or more than a menstrual period, may indicate a more serious issue. One of the most common causes is a miscarriage, particularly if the bleeding is accompanied by cramps or tissue discharge. Another possible cause is a molar pregnancy, which is a rare condition involving abnormal growth of placental tissue. In later stages of pregnancy, heavy bleeding can signal placenta previa, where the placenta covers part or all of the cervix, or placental abruption, where the placenta separates prematurely from the uterine wall. Both conditions are serious and can threaten the health of the mother and baby. Bright red bleeding, clots, or bleeding that soaks through a pad within an hour should never be ignored. Infections or trauma can also lead to bleeding and must be evaluated by a professional. The body is trying to send a signal, and it's essential not to suppress or dismiss it. Early intervention and proper diagnosis can make a significant difference in protecting both maternal and fetal well-being. Persistent headaches during pregnancy, especially when they don't improve with rest or hydration, can be more than just hormonal changes. They can be a red flag. Occasional mild headaches are common due to increased blood volume and hormonal fluctuations, but if the headache is intense, prolonged, or feels different from your usual pattern, it's time to pay closer attention. One of the biggest concerns linked to persistent headaches in pregnancy is preeclampsia, a condition marked by high blood pressure and potential damage to organs like the liver and kidneys. These headaches often feel like a pounding pressure that doesn't respond to typical remedies. When accompanied by other symptoms such as vision changes, swelling in the face or hands, or upper abdominal pain, preeclampsia becomes more likely and requires immediate medical attention. Dehydration, anemia, or gestational hypertension can also trigger headaches. In rare cases, underlying neurological issues or vascular problems like blood clots may be the cause. Instead of just taking a painkiller and hoping it passes, it's crucial to assess the bigger picture. Your body may be under stress and the headache is the alarm. Staying hydrated, getting adequate rest, and checking your blood pressure regularly are vital. But so is knowing when to call your doctor. Blurred vision or sudden changes in eyesight during pregnancy can be a significant warning sign that shouldn't be overlooked. While mild vision fluctuations can occasionally occur due to hormonal changes that affect the shape of the cornea or fluid retention, persistent or worsening vision problems can indicate more serious complications. One of the most concerning causes is preeclampsia, a pregnancy condition involving high blood pressure and damage to organ systems, particularly the liver and kidneys. Vision disturbances in preeclampsia may include seeing spots, flashes of light, or temporary vision loss, and are often accompanied by severe headaches or swelling. These visual symptoms suggest that blood flow to the brain or eyes is being affected and require immediate medical evaluation. In rare cases, vision issues could also be linked to gestational diabetes or a retinal disorder. Sudden vision changes may also indicate elevated intracranial pressure or vascular problems like optic nerve swelling. It's crucial to monitor when the symptoms occur, whether they're constant or episodic, and whether they're linked to other symptoms like dizziness or high blood pressure. Never assume vision problems are just part of pregnancy. They could reflect deeper imbalances that, if caught early, can be managed to protect both mother and baby. Sudden swelling of the hands, face, or legs during pregnancy can be more than just normal water retention. It can be an indicator of an underlying complication. While mild swelling, especially in the feet and ankles, is common due to increased fluid volume and pressure from the growing uterus, rapid or excessive swelling in unusual areas like the hands or around the eyes may signal preeclampsia. This condition is characterized by high blood pressure and can develop after the 20th week of pregnancy. The swelling occurs because the blood vessels leak fluid into surrounding tissues, and the kidneys may not be filtering effectively. If this swelling is accompanied by high blood pressure, headaches, vision disturbances, or upper abdominal pain, it becomes a medical emergency. Another possible cause is deep vein thrombosis, DVT, especially if the swelling is limited to one leg and is paired with pain, warmth, or redness. This can lead to serious complications like a pulmonary embolism. While it's tempting to attribute all swelling to normal pregnancy changes, it's the sudden onset and unusual pattern that should raise concern. Monitoring weight gain, blood pressure, and fluid intake, along with regular checkups, can help catch these signs early and reduce risk to both mother and baby. Decreased fetal movement is one of the most important signs to pay attention to during pregnancy, especially after the 24th to 28th week, when a regular pattern of movement is typically established. Babies have sleep cycles, but a noticeable reduction in kicks, rolls, or flutters could indicate that the baby is in distress. A healthy baby usually moves several times an hour, and over time you begin to recognize your baby's normal activity pattern. If you suddenly feel less movement or go hours without feeling anything at all, it's crucial to act quickly. This could signal problems such as reduced oxygen supply, placental insufficiency, or even the early stages of a complication like intrauterine growth restriction, IUGR. In some cases, decreased movement can precede stillbirth, which is why it should never be dismissed. Simple methods like drinking cold water, lying on your left side, and counting kicks for an hour can help you assess activity. If there are fewer than 10 movements in 2 hours, seek medical evaluation immediately. Your baby's movements are one of the clearest ways your body communicates that everything is okay. Or not. Trust that instinct, because catching a problem early can make a critical difference in the outcome. High fever during pregnancy, especially when it rises above 100.4 DEGF, 38 DEGC, should never be ignored. Fever is the body's natural response to infection or inflammation, and while it might seem like a common issue, during pregnancy it can carry added risks for both the mother and the developing baby. Infections such as urinary tract infections, the flu, or even listeriosis can lead to elevated body temperature and pose complications if left untreated. A high fever in the first trimester can potentially increase the risk of neural tube defects or miscarriage. In later stages, it may signal conditions like chorioamnionitis, an infection of the placenta and amniotic fluid, or other systemic infections that could trigger preterm labor. Fever often comes with other symptoms such as chills, body aches, fatigue, or a sore throat, and these combinations provide clues about the underlying issue. It's important to stay hydrated, rest, and avoid over-the-counter medications without medical approval, as not all are safe during pregnancy. If your fever persists for more than 24 hours, is rising quickly, or is accompanied by symptoms like abdominal pain or unusual discharge, you need prompt medical evaluation. Addressing infections early, helps prevent further complications, and keeps both mother and baby safe. Pain or burning during urination in pregnancy is often a sign of a urinary tract infection, UTI, which is relatively common due to hormonal changes and the pressure of the growing uterus on the bladder. While UTIs may seem minor, they can escalate quickly during pregnancy if left untreated, leading to more serious conditions like kidney infections or preterm labor. The discomfort typically begins as a burning sensation when urinating, accompanied by increased frequency or urgency even when the bladder is not full. In some cases, there may also be cloudy or foul-smelling urine, lower abdominal discomfort, or a low-grade fever. Because the urinary tract is more relaxed and dilated in pregnancy, bacteria can travel more easily from the bladder to the kidneys. If the infection reaches the kidneys, symptoms become more severe. Back pain, chills, and high fever may develop, indicating a condition called pyelonephritis. It's crucial not to dismiss urinary pain as just a minor irritation. Drinking plenty of water, maintaining hygiene, and urinating frequently can help reduce risk, but if symptoms appear, seek medical treatment immediately. Early detection and antibiotic therapy are safe and effective in most cases and can prevent complications that might affect both maternal and fetal health. Severe nausea and vomiting during pregnancy, especially when it persists beyond the first trimester or becomes intense enough to cause dehydration, may be a sign of a condition known as hyperemesis gravidarum. While mild to moderate nausea is common in early pregnancy and often referred to as morning sickness, hyperemesis is much more extreme. It can lead to significant weight loss, electrolyte imbalances, and even hospitalization if not managed properly. This condition may prevent a woman from keeping any food or fluids down, leading to fatigue, dizziness, and in some cases malnutrition for both the mother and baby. The exact cause isn't always clear, though it's believed to be linked to rapidly rising hormone levels, particularly human chorionic gonadotropin, HCG. Persistent vomiting can also raise the risk of complications such as preterm birth or low birth weight. Some women may even experience mental distress from constant illness. It's critical to monitor how often vomiting occurs and whether it interferes with basic nutrition or hydration. Treatment options range from dietary changes and vitamin B6 supplements to anti-nausea medications prescribed by a doctor. Recognizing that this level of nausea isn't normal and seeking help early can greatly improve the health and comfort of both mother and baby. Shortness of breath or chest pain during pregnancy should always be taken seriously, especially if it appears suddenly or is accompanied by other symptoms like rapid heartbeat, dizziness, or swelling. While mild breathlessness can be a normal result of the growing uterus pressing against the diaphragm, severe or persistent difficulty breathing may indicate a more serious issue. One possible cause is a pulmonary embolism, a life-threatening condition where a blood clot travels to the lungs. This is more likely during pregnancy due to increased blood clotting factors. Other causes might include anemia, where the body lacks enough red blood cells to carry oxygen, or even a heart condition that may have been silent before pregnancy. Chest pain, especially if sharp on one side or worsens when breathing, should never be ignored. Hormonal changes can also impact lung function and heart rate, but it's important to distinguish between normal changes and alarming signs. If you experience pressure in the chest, a squeezing sensation, or pain that radiates to the arm, neck, or jaw, seek emergency care immediately. Listening to your body and acting on these signs can prevent complications and ensure proper oxygen supply for both mother and baby.